Good morning, everyone. Today we're going to talk about lip lifts. So who is a candidate for a lip lift? The upper lip skin, like the rest of the skin on our body, sags with gravity with time. And you might notice that your smile has changed or the shape of your lip has changed. So if over the course of your life it looks like you're increasingly frowning, or when your lips are in repose, you actually don't see your upper teeth anymore, this could be a sign that your upper lip is actually sagging and needs to be addressed. For example, this patient here had both a change in her lip shape and complete covering of her upper tooth incisors. So what we did was took a look at some younger photos of her, and actually in the first pre-op consultation, I had her show me with her own fingers in a mirror where her lip used to be and what she thought the ideal position was. On average, this is about 4 millimeters in patients. Once that was confirmed and I was able to see that that is actually what showed the amount of upper tooth that we wanted, we're able to design a subnasal incision that hides just beneath your nose that was able to achieve the shape we wanted and be concealed easily.